My view has always been this is a choice. It is not a mandate. The unborn person doesn't have constitutional rights. So in the third trimester of pregnancy, there is room for looking at the life and the health of the...
And Secretary, I want to ask you about some comments that you made over the weekend on Meet the Press regarding abortion. You said, quote, the unborn person doesn't have constitutional rights. So my question is, at what point does someone have constitutional rights? And are you saying that a child on its due date, just hours before delivery, still has no constitutional rights?
Under our law, that is the case, Paula.
NBC News Wall Street Journal poll indicated a majority of Americans approved of last week's Supreme Court decision to make so-called partial birth or late-term abortions illegal. A lot of American families find this just a hideous topic for discussion.
President Obama supports the brutal practice of partial birth abortion, where a baby is delivered up to the neck, and this living, kicking, half-born baby then has a pair of scissors jammed into the back of their skull, and the baby's brains are sucked out.
Well, this issue came up at the state level, and I voted no on the late-term abortion ban.
But that's just the beginning of the extremism of Barack Obama. He voted 3 times against the Born Alive Infant Protection Act, leaving born babies alone to die. Does anyone really believe we should abandon babies in a utility room to die? The answer is yes. His name? Barack Obama.
Barack Obama defended infanticide, the killing of fully born infants who had survived a failed abortion attempt and were then left for hours in soiled linen baskets to die. Jill Stanek and others blew the whistle on this.
The soiled utility room is where nursing staff takes our biohazardous material, our soiled linens, and it also has a urinal in it. That's where nursing staff took these babies and left them to die.
And that essentially adding an additional doctor who then has to be called in an emergency situation to come in and make these assessments is really designed simply to burden the original decision of the woman and the physician to induce labor and perform an abortion.
That's deep-dyed, cold-blooded, ruthless ideology applied to such a degree that it bespeaks a hardness of heart.
Stephen Pam will tell you that we fought together in the Illinois State Senate against restrictive choice legislation, laws just like the federal abortion laws.
When I testified before an Illinois State Senate committee about my experience, Barack Obama was unmoved and actually opposed the Born Alive Infant Protection Act, which was legislation designed to stop this barbaric practice of leaving delivered babies out to die. Some people have said that Barack Obama was uninformed or may not have fully understood the implications of this bill, but he voted against it 3 times. At the end of the day, his opposition was responsible for living babies being left out to die.
It is time for a different attitude in the White House. It is time for a different attitude in the Supreme Court. It is time to turn the page and write a new chapter in American history. Fully convinced culture wars are just so 90s. So we're not just going to win an election, but more importantly, we're going to transform this nation.
You're recognized for a question, sir.
Thank you, Mr. Chair. So it's just really hard for me to even ask you this question because I'm almost in disbelief. If a baby is born on a table as a result of a botched abortion, what would Planned Parenthood want to have happen to that child that's struggling for life?
You're recognized.
Thank you, Mr. Chairman. Well, we believe that any decision that's made should be left up to the woman, her family, and the physician.
Okay, Chair Davis, and then we'll come back to you, Rep. Oliva.
Thank you, Mr. Chairman. And I believe you were in the committee room whenever I asked Representative Pigman the question about what happens in a situation where a baby is alive, breathing on a table, moving. What do your physicians do at that point?
You're recognized.
I do not have that information. I am not a physician. I'm not an abortion provider. So I do not have that information.
Follow up. Go ahead, sir.
I understand that you're not a physician, but you do represent
Yes.
Physicians who do perform this activity. And can you tell me what happens when a baby is alive on the table at that point? What do they do with the baby that is struggling to live?
You're recognized.
I don't know, and as it's been referenced earlier, we don't know even how prevalent this situation is.
I don't know how else I can get an answer, Mr. Chairman.
All right, we'll go to Representative Oliva for his question.
Thank you, Mr. Chairman. Along the same lines, you stated that that a baby born on a table as a result of a botched abortion, that decision should be left to the doctor and the family. Is that what you're saying?
It should. Thank you, Mr. Chairman. That decision should be between the patient and the healthcare provider.
Follow up. Go ahead, sir.
Thank you, Mr. Chairman. I think that at that point, the patient would be the child struggling on a table. Wouldn't you agree?
You're recognized.
That's a very good question. I really don't know how to answer that. I think, I would be glad to have some more, conversations with you about this.
Thank you, Mr. Chairman.
Representative Cleland for a question.
Thank you, Mr. Chair. If the law doesn't speak to a physician's obligation in an abortion clinic setting, then what conflict do you have here? You mentioned in your testimony that the law already speaks to that, but if it doesn't in the abortion clinic setting, what issue do you have with that being codified in this bill?
You're recognized.
Thank you, Mr. Chairman. Okay, I'm not sure I understand your question.
You can rephrase it.
Thank you. From what I gathered from your testimony, physicians have an obligation already under the law to provide advanced life support to a child born alive. But if the law doesn't speak to that in an abortion clinic setting, and I think the bill sponsor, who's a physician, testified that it doesn't, then what issue would you have with that being in the current bill?
You're recognized.
Okay, are we talking about my reference to the federal law?
I suppose so, yeah.
Okay, because I just want to be clear. We support the neutrality clause that was in the Federal Born Alive Infants Protection Act of 2012, which has been addressed.
Follow up, Mr. Chair. Does that address the obligation of a doctor in an abortion clinic setting to provide advanced life support to a child who was born alive in an abortion?
No, the neutrality clause addresses the situation where this particular language can't be extrapolated out through other, statutes dealing with abortion. It just deals with this particular area.
Okay.
So,
sorry. Notwithstanding that, does Planned Parenthood have an objection to a doctor being obligated to provide advanced life support in an abortion clinic setting to a child born alive? I mean, I guess you do, or you wouldn't be here, right?
You're recognized.
Thank you, Mr. Chairman. Let me just pause and say where our opposition remains. Okay, then maybe that can answer some questions. We have serious concerns about the surrender wording in this. The second piece is, as you all discussed earlier, was the transport to the hospital. We would like to be in a position to remove our opposition, and again, Representative Pigman has been great to work with. He's been very friendly to us in terms of some language that we were trying to seek. So I do want to give him kudos for that.
One final follow-up, Mr. Chair. I appreciate the indulgence. What objection could you possibly have to obligate a doctor to transport a child born alive to a hospital, where it seems to me they would be most likely to be able to survive?
You're recognized.
Thank you, Mr. Chairman. What about this, and I'm just speaking out here, what about those situations where it's in a rural healthcare setting, the hospital is 45 minutes to an hour away, that's the closest trauma center, emergency room. There's just some logistical issues involved that we've got some concerns about.
Okay, thank you very much, and we will proceed.
Thank you.
I think we're done with questions of members here. Thank you, ma'am.
The next technique we're going to demonstrate is the partial birth abortion. Partial birth abortion is a term that we hear a lot about in the news, but I really can't believe that people really understand what it means. Otherwise, we would not allow this procedure to be performed anywhere, not only in this country, but in the world. But a partial birth abortion is performed when the baby is too far developed in order to either be sucked out with the suction curette or to be able to be dismembered and brought out piece by piece with this forceps. A partial birth abortion, or a D&X, is very similar to what it says. We're going to deliver the majority of the baby, and then before the baby's head is delivered, then we're going to actually kill the baby. Now, before the procedure would start, the cervix would have already received those things we talked about called laminaria. Those are the sticks that go into the cervix that would then swell overnight and would open up the cervix because we have a lot more baby to deliver. And this can be performed anywhere up to term because remember, Doe versus Bolton defined mother's health as physical, emotional, psychological, familial, and age. So as long as the physician under those definitions says mother's health is in jeopardy, this procedure can be performed. Now, using an ultrasound to guide, the cervix will be dilated, the speculum would already be in place to open things up, and then using the ultrasound as a guide, this instrument would be placed in the inside through the cervix and would then grab one of the baby's feet. Once that foot is grabbed with that tenaculum, that baby's foot is then brought to the outside. Once that first foot is brought to the outside, then the second foot would be brought to the outside. And then with traction with a baby that is still alive, the baby would then have both legs delivered, would then have its belly delivered. Once the baby is brought further down, first one arm would be delivered. That would be rotated this way. And then the baby's rotated around the other way, and the second arm is delivered. Now the entire baby from the neck down is now alive and in the abortionist's hands that's performing this procedure. The entire baby, including the head, are already out of the womb, beyond the cervix, and the only thing that's left on the inside of the mother is the baby's head, but that's only just inside the vagina. And baby is moving, baby is alive, baby is intact up to this point. But if the baby then delivers, it's then considered a live birth and the baby would have to go to the nursery. But before that's allowed to happen, this is when the abortion would actually kill the baby. And the way they do that is, if you remember from biology class, there's that connection between the brain and the spinal cord, and that opening at the base of the skull is called the foramen magnum. And that small hole with the baby moving and alive in one hand, a pair of scissors, these are called Metzenbaum scissors. These scissors are then placed into the base of the skull, and these scissors are then placed in through that foramen magnum up into the baby's brain and skull cavity. The scissors are then opened up, and then if that hasn't killed the baby, then one of the suction curettes is then placed through that same hole up into the baby's skull and brain. The suction is applied, and just how you saw how powerful that suction machine is, if it can crush the steel can, then it can definitely kill the baby there on the inside. Once the baby has then been killed and is no longer alive, then the remainder, which is just the baby's head, is then delivered, and the procedure is then completed for the delivery of the baby. Once the baby is delivered, though, then the only thing that's left is to deliver the placenta by just, again, scraping the placenta and bringing that down. So when you hear the term partial birth abortion, that's what's going on. A baby is being delivered the feet, the abdomen, the chest, the arms and the legs. The baby is then killed, and then once the baby is killed, then the remainder of the baby is allowed to be delivered. So that's partial birth abortion.